Hi guys, welcome back to my YouTube channel. If you're new here, my name is Chisom. I vlog about my life here as a new migrant, as a student, as a mother, giving you gist and tips here and there from time to time. If you are an old subscriber, of course you know that you are the real MVP. You are the reason why we do this every week. You're welcome to today's vlog. So guys, the health and care worker route, is that the only pathway for you to actually migrate and live in the UK as a skilled worker? I asked this question because a lot of people have asked me personally, what is my view, what is my take on this? They are doing one job or the other back home in Africa as a banker, as an engineer, as stylist, what have you. And then they're contemplating leaving this job, resigning from this job, packing up this business and moving to the UK in search of greener pastures. And then everybody is just talking about health and care work, health and care route, health and care route. And I'm asking, do you people actually know that health and care is not the only pathway through which you can migrate to the UK as a skilled worker? It's one of the occupations in the shortage occupation list, quite all right, but it is not the only occupation in that list. So whatever it is you're doing back home and you feel you want to move to the UK to be a better version of you, to do better in this particular career, you can look up the list. Go to gov.uk. You will find a list of occupations in the shortage occupation list through which you can start looking for jobs, start applying. If you get an employer who is interested in you, the employer will do your interview, shortlist you, go through the normal procedures, give you a letter of employment, give you a COS with which you can now apply for your visa and you're on your way to the UK. The health and care worker route is not the only pathway for you to come to the UK to work as a skilled worker. The reason why I'm saying this is because of the trending video, that is all over the internet. I don't know if you have seen this video. If you have not seen it, let's watch this video together. After that, I will tell you.
Kò lè wọ mọ́tò, kò lè wọ mọ́tò kankan. Kò sí ọ̀nà. Oh, daddy, kini ẹjìlẹ̀ kúkọ mú. Ẹyẹ máa tulẹ̀ kúkọ.
That's fine. Let them take. Let them get hold of me.
She's not getting in the car.
She's not getting until the police come. The police are coming. Have you called the police? The police have to come. No. Let the police come. Let the police come. I am recording it right now. I am. I am recording it. Let's go now. Yes. Oh, she blocked her. You didn't see when she blocked her. But you didn't see when she blocked her.
She blocked me.
She blowed her. She blowed her on her eyes. She blowed her on her eyes.
You are not ready to help me. My name
You are not. You are not.
You blocked me.
You are not.
So guys, apparently what happened in that video is that these people from back home paid someone, an agent, some money to give them a COS. You might ask, what is it about the COS? What is it? Okay, COS, let's explain. COS is the document you need as a skilled worker for you to apply for your visa to come to the UK to work as a skilled worker. If you are working, if you are experienced in one of the jobs on the shortage of occupation list, which includes the health and care worker, care assistants, and the rest of it, you will start applying to these organizations that have vacancies. When a particular organization is interested in your skills and your abilities, they've interviewed you, you've read your contracts, everybody is fine. Both parties are fine. You sign your contract. They issue you a document, your COS. That COS is what you will use to apply for your visa, indicating that this organization is your sponsor. And when you come over to the UK to work as a skilled worker, this organization being your sponsor is the only organization you can work for with that COS. If peradventure something happens and you couldn't work for them again, you need to go and work elsewhere. Then when you go and work elsewhere, this other employer you're now working for will also issue you another COS, meaning the previous sponsor that brought you into the country is no longer sponsoring you, but you are now being sponsored by this new employer. So whichever the case, whatever the case, you will always need this COS from any employer you're going to be working for. So what happened is that apparently this group of people, they paid money to these agents to bring them into the country as health care workers. Where they came, unfortunately, arriving in the UK, there was no job. They were not getting shifts. Of course, you know, the money involved is a lot of money. We are talking about 10,000, 15,000, 7,000, depending. That is as high as these agents will charge. These people will pay for this job. They will come into the UK. There is no job anywhere. What are those things you're going to look out for? I've always told people that are close to me, when you're looking for a job from outside the country as an overseas candidate, and a particular employer is interested, whether you know upfront, whether you know outright that this person is an agent, he's not the direct employer you're going to be working for. Perhaps they told you outrightly that the only thing they're going to give you is your COS. When you come here, you find your way. They might tell you, they might not tell you. But let me tell you the things you have to be very careful about. If an employer is really interested in bringing you into the country as an overseas candidate, the employer does everything for you, issues you this COS. Maybe in some cases, you pay for your visa, pay for your logistics and all that. Some people will even go to the extent of paying for your visa, paying for your flight, everything just for you to come. That shows an employer that really is in need of his staff, because they can't spend all that money when there's no job here for you to do when you arrive. That is how to know employers that are genuine. You know you're going there to work. If you're leaving whatever you're doing back home, you know you're going there to work. There's a job there waiting for you. But when it comes to you paying money to get COS and then coming to the UK, be careful. Sometimes, in many cases, there is no job anywhere. Woe betide you if you borrow this money from people, hoping that, of course, when you come, you start working, you start paying back. You will stay here 3 months, 6 months, 1 year, no job for you, no shift. Because it will be difficult for you to get another employer who is ready to give you their COS. After this other employer has brought you in, you have to start explaining, why are you now working for the person that brought you into the country? And this health and care worker route people are really rushing into to go and do. It's not that easy. Forget about the fact that it's almost like it's the easiest way out, because the qualifications are not high. Being a graduate, even without being a graduate, you're qualified. Then you talk about experience. Once you have experience, maybe taking care of your aged relative, working in a hospital, you're qualified. For the IELTS, I think is about around band 4, band 5. That's all you need. So you see a lot of people thinking that healthcare is a very easy sector to switch to. They don't know that it's not as easy as it looks. Healthcare is a very easy sector because you feel, oh, is it not just taking care of people? What's there? After I took care of my grandmother free of charge, nobody even paid me, so why don't I earn money doing it? Yeah, we know. But when it comes to a professional level, a professional atmosphere, you find out that it's not that easy. In fact, let me tell you, healthcare is one of the jobs that can easily land you in jail in this country if you're not careful. Yes. As easy as it is, everybody is running into healthcare to be a health and care worker, to be a healthcare assistant. People from all walks of life, bankers, engineers, stylists, everybody, architects, everybody is running into health and care. It's not as easy as it seems. They will not tell you what is in it. If you don't have the right qualification, maybe you are not a nurse, or you have never worked in a hospital before, you don't even know one, please, I advise you, leave health and care alone. Go and look for other occupations on that shortage occupation list. Go and look for the jobs there, occupations there, and apply to it. And be patient. Be patient while you're applying. If peradventure you didn't succeed in getting yourself an interview, then you just know you're not qualified. You look for other means. There are other ways. There are other countries. Talk about Canada. If you're saying UK is too expensive for you to come and study, what about Canada? Canada is not that expensive. Canada, you can even be in the express entry pool looking for jobs and all that. Before you know it, you land the job. When you're even going to Canada, as you're leaving your country and entering Canada, you already have your PR. So why don't you explore these other options? If you have money to pay for health and care COS, we're talking about 10,000, 15,000. Then let me tell you, you are doing well wherever you are. Don't think it's a quick way out of where you are. You can wait. You can wait. Whatever you're doing there, be doing it while you're waiting for other ways, other jobs that maybe you can get a job that relates to what you're doing in your home country, or you can get your access to other countries like Canada, like the US, like Australia. It's not only UK. It's not only UK. People should stop putting themselves into trouble. Let me tell you, this health and care worker, a lot is happening in it that nobody tells you until you enter. It's an occupation that it not only requires you to be compassionate, empathic, you need to be careful. You need to pay attention to details, because any little mistake will land you in jail. It's a place where there is little or no space for mistake, because you are taking care of vulnerable people. If, for example, you're working as an accounting bookkeeper, or you're working, there are some mistakes you do in your system. Your supervisor will just tell you, look at this, why is this book not balancing? You start tracing, you start reconciling, and before you need to find out. But we are talking about vulnerable people here. A mistake could cost somebody's life. And why you are so much to be blamed, why you are going to answer for it, is because these people's life, their safety is entrusted into your hands as their carer. It's not something you just rush in because it's an easy way out. You are setting yourself up for destruction, especially if you don't have the experience required for this job. Most of these people that you pay money to get COS, they don't even do an interview. They just give you COS and you are just coming in, you are rushing to go and get your first shift. And then peradventure, you get this first shift and you go there, will betire you. You're getting to that client's house, you didn't even go through their care plan, you didn't even check, because there are some things you will not learn from training. Training is just highest 1 week. There are some things that they will not even mention when they are giving you this training. They just assume that you're supposed to know. After all, you said you have the experience. So there are some things that is not even said. Not like they are intentionally, hiding these things, but just by human nature, it's not mentioned. You only find out when you are in the field, when you start doing your job. I had a case of a lady that went to give personal care to a client. On getting there, I don't know whether she didn't read the care plan or she didn't pay attention, but it happened that this particular lady, the particular client she was taking care of, in her care plan, it was stated that you shouldn't pour water on her face. Yes, that you shouldn't pour water on her face. So when you're giving her a shower, when you're giving her a bath, whatever you do, however you want to give her bath or shower, please do not pour water on the face. And when they say do not pour water on the face, there is a medical reason why that is so. This lady didn't pay attention to that. She went, gave the client a shower, poured water on the face, and then the client developed complications and she was arrested. Little things like that is what I mean by paying attention to details. Or maybe you are a carer, and this one, it usually happens in domiciliary settings, because if you are in a care home, most of the time as a healthcare assistant, you're not the person to administer medications. There are seniors to do that, yeah. But in domiciliary setting, you might find out that at any particular time, you are the only one in the client's house taking care of them. So, and most of the clients in the domiciliary setting are people that, to some extent, they are independent. You are just there to help them, assist them, 1 or 2 house chores, prepare meal, light housekeeping, and then remind them to take their medications, to take their fluid, keep them company, basically. Now, on getting there, you feel maybe because you're a good person, I want to help this client. You want to help the client to take medication, and then you carry their medicine and start giving them, they will catch you. You do not have the license to administer medication. You can only remind them to take their medication. You can only put it in their hand and give them water to help them take the medication. You cannot administer medication if you don't have the license to do so. My dears, health and care job is a job that, as much as it is something you enjoy doing, if you are the type that really loves chatting, loves taking care of adults, love doing all these things, but you have to be careful. As much as it's an easy way, because as it is right now, the health and care is booming, the sector is booming, it's the only way people are moving in numbers. But don't fall prey. If you will do it, wait for an employer that will assess you, give you the necessary guide, tell you the necessary trainings to do, and if you qualify, they give you your interview, recruit you, and bring you over, instead of you to go and be paying all this money for COS. Is it really worth it? I don't even think it's worth it. So guys, after watching this video and seeing what happened in that clip, I hope you're better informed. Don't fall for that. Even if an agent is telling you, well, you just get your COS, the important thing is for you to get your visa first and come into the UK. Once you get here, you can look for other things. Don't fall for that. Don't fall for that, because bills, you're going to be paying bills wherever. In fact, when you come in self to even rent a house, that one is story for another day. We are going to do another video of how difficult it will be for you to get a house here in the UK, let alone when you now get this house and then you are not working, no money to foot the bills. House rent is monthly. What other thing? Bills are monthly. Your council tax, your house rent, electricity, water, they are monthly. So whatever it is you're doing, make sure that you plan yourself very well so that you don't get stranded. If you're hoping to go and put up with relations here and there in the UK, nobody will accommodate you for so long. But 1 week, 2 weeks. In fact, you don't even want to be an inconvenience to anybody if you're any reasonable person. If you're a reasonable person, you wouldn't even want to be an inconvenience to anybody. Because bills in this country, they are not smiling. So don't go and be hoping on people you will rely on. Make your plans. Make sure that whatever plan you're doing is sustainable. If it's not sustainable, please tell that agent no. Use your money for something else. I talked about the study pathway where you can come in, study your degrees, your master's degree, or whatever it is you want to do. After your study, if you don't want to go back home, you can apply for the postgraduate work visa. They will give you postgraduate work visa. That one is for 2 years. After that 2 years, you must have gotten a job by then that will enable you to switch to the skilled worker visa. And then you start counting your years towards your indefinite leave to remain. That option is still there. So I don't see this option of paying agents to buy COS is not worth it. It's not worth it at all. I'm seriously telling you, but you know that people will not know until you move. By the time you come in here, it will now dawn on you, like your eye will clear. But please, my darling, don't make that mistake. Use that money and look for another pathway. There are so many of them. Go to Canada. I'm going to do a video for Canada pathway to immigration to Canada. If I open Canada for you people, you will be amazed. There are so many options. So many options. Is it skilled workers, express entry? Is it the skilled trade? Is it provincial nomination? Is it study? A lot of options are there. But the problem is that our people, we don't do research. We don't do research. So once one thing starts raining, one pathway starts raining, everybody's following it. You all follow the bandwagon. Nobody wants to even do research. There are so many other avenues. So many other avenues. I'm going to do a video for that Canada for you people. Since you don't want to do research, you're going to watch it here. It will open your eyes to even research more on it. Go to canada.ca. You will see options there. I'm talking about the Canada. There are other options for US. What are you saying? Why is everybody trying to? Because people, you want to follow the crowd. Do your own research. Do it when it is convenient for you. Do not follow don't let any agent pressure you into doing something, because when you come here, you see that agent that is promising you they are going to pick you from the airport, take you to your house where you will be staying. The next day, they'll carry you in your convoy to the office. When you come here, they will block you. That's what happened in that video. What happened to those people? When you come here, they will block you. You are on your own. That money they're collecting from you is the business they opened. There is no job anywhere. So please, do not fall prey.